Hi, my name is Jen Lowe. I am a licensed professional counselor and a registered play therapist in Jackson, Michigan. This video is going to talk a little bit about trauma therapy for kids and teenagers. So I'm actually trained in two different things. The first one is eye movement desensitization and reprocessing, EMDR. So I've done the basic level 1 training for EMDR, but then I've also done some extra trainings on how to modify that and incorporate some more fun strategies to engage children and teenagers. It's a great treatment. I think I have a whole YouTube video about EMDR. The second thing that I am nationally certified in is something called TFCBT, and it stands for Trauma Focused Cognitive Behavioral Therapy. I used to live in North Carolina. I have a license there as well. And TFCBT was really, really popular in North Carolina. I'm surprised it's not more well known in Michigan, but in North Carolina, it was very common for like judges, attorneys, social workers to know what TFCBT was. And if we had a child who had survived a traumatic life experience, sexual abuse, physical abuse, neglect, natural disasters, it was very, very common for the professionals to not just recommend, oh, take your kiddo to counseling, but hey, you need to get this evidence-based, research-backed treatment called TFCBT. In fact, I originally got trained in TFCBT because there were insurance companies in North Carolina that would not credential child therapists who worked with trauma unless they were certified in this. And insurance companies in North Carolina, some of them pay us more if we were trained in this. It's a great, great modality. I love Dr. Cohen from Pennsylvania and was originally trained in Pennsylvania and went to meet her. It also incorporates parents, it incorporates coping skills, it incorporates this cognitive triangle, thoughts, feelings, and behaviors. How do we think about things in a healthier way? It includes a trauma narrative process where kids and teens have an opportunity to tell their story or to tell their narrative. And if they're not writers, there are other more fun, artsy ways to do this. So throughout the years, I've had kids who've made a collage of trauma reminders. I've had kids do like an acrostic poem. So the narrative or the telling of the story does not have to be like a written thing. I have been trained in this so long that my certification actually needed to be renewed, and I had to take extra classes recently. And it is just amazing to read the research, not just in the United States, but in other countries, of how helpful TFCBT is for people compared to just, I'll come to therapy for a few weeks and talk about what happened. It is a good evidence-based treatment. I am in network with Blue Cross Blue Shield and I accept private pay. My office is in downtown Jackson. If it's an older kiddo, I don't mind meeting telehealth, but sometimes the younger ones need to come in person so they can wiggle and move and take a break and fidget with a fidget from the basket. My website is jenlow.care. Thank you.